In the United States, President-elect Donald Trump has said that Robert F. Kennedy Jr., his pick to head the U.S.'s top health agency, will help make America healthy again. Now, those were Trump's words Thursday evening at a gala event at his Mar-a-Lago resort in Florida. His nomination of the vaccine skeptic to become health secretary is just the latest in a string of controversial choices for government agencies. All right, for more now on Trump's controversial cabinet picks, I'm joined by DW Special Correspondent Aya Ibrahim. She's in Washington. Aya, President-elect Donald Trump, he's wasting no time in putting his cabinet together. He's basically staying true to his campaign promises. So why are we seeing, so much shock and surprise, especially among some Republicans?
I think it's because earlier this week there were reports that RFK Jr. would actually not be considered for a cabinet position. This reportedly came from someone pretty high up within the Trump transition team. Reportedly, this angered RFK Jr., who has been, in the president-elect's close proximity since Election Day. So this definitely, as you said, a lot of these nominations have been raising a lot of eyebrows, but this particular one, it seemed initially a couple of days ago that it wasn't going to happen. But RFK Jr. Did, step out of the presidential race. He was running as an independent after having wanting to run as a Democratic candidate for president. And so having some sort of function or position in the Trump administration was expected, but there were hopes that it wouldn't be for this particular sort of very high-profile position, given his own statements about vaccines and controversial opinions on health policy. This this nomination for Secretary of Health, he would be in charge of the Food and Drug Administration. He would be in charge of government-funded healthcare, and so it's quite a big remit with a lot of consequence.
Yeah, and the U.S. Senate will need to confirm Robert Kennedy Jr. first, and I'm wondering how much opposition will Kennedy face in a Republican-controlled Senate?
Even though this is, as you mentioned, a Republican-controlled Senate, RFK Jr. is not a Republican Party insider the way that some of the other nominees are. He wanted to run as president as a Democrat. He then became an independent and sort of more recently migrated to the Trump camp. So he could face opposition within a Republican-controlled Senate from lifelong Republicans who would still see him as an outsider. But that is it's unclear what will happen at these confirmation hearings, and to what extent, even Republicans in the Senate who may be opposed to such a nomination will act sort of from pressure coming from a certainly very emboldened president-elect who not only won the electoral vote, but also won the popular vote. So there might be some resistance to him, as well as some of the other more controversial nominations like Matt Gaetz.
And there's new data out today that shows for the first time half of all Americans, half, are either overweight or obese. Trump has campaigned with the slogan, "Make America Healthy Again." What are Kennedy's plans for doing that? What are you hearing?
He has made all kinds of, RFK Jr., Kennedy has made all kinds of statements and promises about how he wants to reform the Department of Health, including slashing a lot of jobs at the Food and Drug Administration. There are about 18,000 employees in the Food and Drug Administration who do enjoy some employment protection given to them by lawmakers. So it's still unclear how he, as an outsider, would be able to actually exert influence within such a massive administration. But that's just something that we're going to have to keep watching, especially closer to the confirmation hearing and whether or not he actually ends up getting confirmed by the Senate. Now, of course, there are huge chronic issues when it comes to health in the United States, but experts are simply skeptical about whether he would be the person to fix it, given, again, his unfounded theories about vaccines, the link between vaccines and autism, for example.
DW Special Correspondent Aya Ibrahim with the latest from Washington tonight. Aya, thank you. All right, what could an anti-vaxxer mean for global health? I want to bring in now Margaret Harris. She's spokesperson for the World Health Organization. She joins me from Geneva tonight. Margaret, good to see you again. I want to start with a few things that RFK Jr. has said in the past. I'm sure you're familiar with him. He has said that Wi-Fi causes cancer, COVID is a racially targeted bioweapon, and he said that HIV is not caused by a virus. Now, if anyone with these claims were to apply for the top job at the World Health Organization where you work, would that person be hired?
So, I'm not going to comment on hiring. In WHO, we have processes and we follow a very complex recruitment process. So that question doesn't really apply. And it's also for WHO's member states to make their own decisions on the direction and implementation of their national health policies and agendas.
But those claims would raise some eyebrows, though, wouldn't they?
So we look at the science for all the different subjects. And as you know, we follow the science and we provide all the data in detail. But I'm not really here to discuss what somebody has said or has not said.
Well, let me ask you this, Margaret. We know that Donald Trump has chosen a vaccine skeptic with no real health credentials, no medical training to lead the nation's health agency. What is your take on that and the implications it could have for global public health?
So I think it's important to look at vaccination, certainly. Vaccination is something that saved, we calculated recently, 154 million lives. And that's an extraordinary thing. And every year, childhood vaccination saves at least 5 million children. You look around you at the people you see, these are people who are alive today, many of them, because they got vaccinated. But one of the problems with vaccination is it's been so successful. It's a thing that the diseases that it's been preventing have disappeared in communities that have had access to good vaccination. So unfortunately, especially in the wealthier communities with great access to vaccination, people are now beginning to believe these myths because if the vaccination, you don't see the effect simply because people are living and are healthy because they got vaccinated.
And I wonder if there is going to be some type of domino or knock-on effect here. You and I, we've spoken many, many times over the course of the past few years about vaccines against COVID. Now you may have the Secretary of Health and Human Services in the United States, an anti-vaxxer there at the top. I mean, this certainly has to concern you, doesn't it? I mean, what he says will have weight beyond the borders of the U.S.
I think it's important to understand that the United States is a very vital partner of the World Health Organization, and our collaboration has significantly improved the health of Americans at home, people around the world, and that will continue. Remember, all the Americans, all the people working in health will continue to work in health. We work closely and productively with the United States government in response to all sorts of things, including disease outbreaks like Marburg in Rwanda, polio in Gaza, and these things are going to continue.
Would having an anti-vaxxer in a position of power, such as the Secretary of Health and Human Services, would that make your efforts at the WHO more difficult? Because the goal, of course, is to get everyone vaccinated, is to stop diseases from spreading. Would an RFK Jr. in power, would that make that effort more difficult?
Remember, we have 194 member states, and they have the governments have different constituents, and they come and go because most countries in the world are democracies and governments do change. And we get a lot of diversity of opinion. But the people who really work in health are strongly technical people who understand the science. So regardless of what comes and goes in governments, the work happens at community level, happens at academic level, at scientific level, at medical level, and that is what really improves the health of the world's people.
I know that one disease that the WHO is still fighting against is measles, and I know that measles cases have risen globally. Global measles cases, I think, surged to an estimated 10.3 million in 2023. That was a 20% increase from the previous year. If the United States, under the leadership, the public health leadership of RFK Jr., if it would really drop out as a pro-vaccine supporter, what would that mean to the fight against the spread of measles globally?
Certainly, you're right to raise measles as a really, really important disease that can be stopped by vaccination. In fact, we estimate that 64% of the lives that have been saved through vaccination have been saved through use of the measles vaccine. And that's an extraordinary achievement. With the rise in measles, and you're quite right, we produced a report yesterday showing that the biggest outbreaks are actually in the countries that are not vaccinating well enough at the moment, and that's mostly in Africa and in the Middle East. Also, those are places where the children are very immunocompromised, so that's sadly where we're seeing the deaths. We have seen a rise in Europe as well, but it's not necessarily due to anti-vaxxers. It may well have been due to lack of access during the COVID pandemic.
And Margaret, too, there could be one possible culprit here could also be this dangerous mix of misinformation that we have, particularly on social media. We have that. We've got climate change, which could be helping in the spread of epidemics. And now, of course, we could possibly have a vaccine skeptic in charge of health policy in a superpower. How concerned are you moving forward for global public health tonight, the middle of November 2024?
We're concerned about public health every day, every night. That's what we do. It's certainly what keeps us awake. But you're right to mention misinformation. There's a rise in misinformation. There's been a massive rise, particularly during the COVID pandemic, because people were so frightened. They were looking for answers, and in some countries there was certainly a loss of trust in either leadership or in science. So we've massively expanded our teams working on misinformation. But I can tell you, day and night, we worry about global public health.
Margaret Harris, spokesperson for the World Health Organization in Geneva. Margaret, we appreciate you taking the time on this Friday evening to talk with us. Appreciate you taking my questions. Thank you.
Thank you, Brent.
Well, for more now, I'm joined by Ashish Jha. He's the dean of the Brown University School of Public Health. He's also a former Biden White House COVID coordinator. Mr. Jha, it's good to have you on the program. You've seen it as we have. Donald Trump has chosen a vaccine skeptic with no real medical training to be in charge of the U.S.'s health policy. What's your reaction?
So first of all, thank you for having me here. I'm deeply concerned about this choice. I think it's a mistake. It isn't because he doesn't have medical training. Most health secretaries have not. It is because of the views he espouses and how they are in contradiction to how we make progress in the scientific and medical community. His ideas, whether they're on vaccines or whether they are on a whole host of issues, are basically refuted by good scientific evidence. And so I'm very, very worried about this. One last point. This is not just a job overseeing the vaccine program of the United States. The health secretary has a profound influence on the health insurance of all Americans. So he oversees Medicare. So this is going to have a very large effect on the health of the American people.
You are a former White House COVID coordinator for the Biden administration. I remember seeing you on television a lot during the pandemic, part of the public health campaign to make sure people knew what was going on. Can you imagine another pandemic happening with both Donald Trump as president and Robert Kennedy Jr. as health secretary? Would that be a nightmare scenario, in your opinion?
It would certainly make things dramatically harder. And let's go back to 2020 when we had the pandemic. The silver lining, the one part of the pandemic that response from Donald Trump that worked very well was the development of these vaccines, Operation Warp Speed, the Moderna vaccine, the BioNTech Pfizer vaccine. Those were driven by Donald Trump. I cannot imagine with Robert Kennedy now in the Secretary of Health seat, us doing something like that again. So it would be very, very concerning. This is a person who does not really believe that infectious diseases should get much priority in the next administration. That obviously raises concerns for all of us who care about health very broadly in the country.
If U.S. public health is based on a belief in science, but also a trust in common sense, if the U.S. Senate confirms RFK Jr., who then would be able to stop him from undermining the American public health care system with his false claims and conspiracy theories, which he likes to spread?
Yeah, so our public health system is complicated. States have a role, thankfully, and I think that will make a difference. Many states will continue to promote sensible policies on vaccines, on fluoride, on a variety of issues. Pasteurization of milk, which he doesn't believe in. Mm-hmm. But the problem is the federal government still has a very large role to play. It purchases vaccines for poor children. It's the one that determines which vaccines will be covered for free by health insurance. So he can still do damage to all Americans, even if certain states step up to try to protect against his worst effects.
I want to ask you about new data that's just come out that shows for the first time half of all Americans are either overweight or obese. Donald Trump campaigned with the slogan, "Make America Healthy Again." Now, if I understand you correctly, America is heading towards an unhealthier future. Where do you see the biggest risks right now?
Yeah, and this is a place where, surprisingly, I think Robert Kennedy would agree that obesity is a major health crisis for the United States. The question in my mind is, what are we going to do about it? And how are we going to determine which policies to implement? My view is we should use policies based on scientific evidence and rigorous analysis. Robert Kennedy's views are largely things that fit well on a bumper sticker, on a slogan. But, he says we should remove additives. Okay, which additives? How do we decide? His track record does not suggest that he is going to take scientific evidence into account when making those decisions. So obesity is a real challenge in the country. I have a lot of skepticism of his ability to make progress on it. Obviously, we want to see progress on this. We'll have to see what specific policies he rolls out.
Yeah, Mr. Jha, let me ask you, before we run out of time, Robert Kennedy has made many claims. Some are known around the world. He says that vaccines cause autism. He says that COVID is a racially targeted bioweapon. And he says that HIV is not caused by a virus. If one of your students were to write a paper, for example, and make those claims, what kind of grade would that student get?
Well, look, my general view is you can make any claim you want as long as you can substantiate it with evidence and facts. And the more bold the claim, the more substantial evidence you will need to generate. The problem for Robert Kennedy is he makes very bold claims that have been refuted by the facts. And so if a student of mine turned in a paper where he did not use evidence and data to make those claims, they would get an F and they would be asked to do the assignment again.
Yeah, F as in fail. Ashish Jha, Dean of the Brown University School of Public Health. We appreciate your time and your insights on this Friday. Thank you.